We will come to our last speaker, and I'm sorry, we heard many good experience from Serbia, and we want to close up also our European section with the host country, and I would like to introduce Ms. Nena Stevanović, who is a specialist of physical medicine, and she developed the rehabilitation program in Merkur Hotel in Vrnjačka Spa, and now we will hear the experience from Serbia, because she made also medical research, and that's also important, not only to develop the program, but also to make the follow-up and to have some result to make the right lobby. So Nena, please, the floor is yours.
Thank you very much. We really enjoyed today, and I'm glad to close the session in this wonderful day. And I hope that everybody had the opportunity to learn something new. So, dear colleagues, allow me to greet you all on the behalf of the Special Hospital for Treatment and Rehabilitation Merkur from Vrnjačka Spa, Serbia, and to thank the organizers, Natasha, thank you, for inviting us to participate at the 12th CEI Regional Forum for Health, Wellness and Spa Industry. My presentation today is about post-COVID rehabilitation in the Special Hospital Merkur in Vrnjačka Spa, Serbia, with its contents and treatment methods of the SPA program, and at the end, the current state of our spas and evaluation results of post-COVID rehabilitation in the period from May to December last year. Because the time is limited, I will start immediately and I will answer your questions later. A number of people who have been affected by COVID-19 afterwards face physical, cognitive and mental problems which cause reduced performance in everyday activities. In order to help such people return to their normal lifestyle, the Merkur has created a plan of providing specialized multidisciplinary post-COVID-19 care and rehabilitation. The program is intended for patients with chronic exhaustion, fatigue and muscle weakness, shortness of breath, cough and chest pain, joint pain, headache, anxiety and depression. Of course, only for patients that are discharged from hospital and who are 4 weeks post the acute phase. The post-COVID program includes medical examination by specialist and subspecialist, cardiologist on first day, with ultrasonic heart examination, ECG, medical examination by pulmonologist, endocrinologist, because it's a common thing to post-COVID patients that they have a problem with glycemia or have diabetes. Mostly on insulin therapy. We also have exam by neurologist and of course radiologist for lung X-ray. Taking oxygen saturation, laboratory services, all. And of course, when they finish on the first day these exams, they have examination by specialist of physical medicine and rehabilitation, who is designing a tailored plan of rehabilitation. Kinesis therapy based on the evaluation of the patient's overall condition. Tests on prior and departure, a relaxing workout, breathing exercise, aerobic workout or swimming in the aqua center, mineral water pool or workout in the fitness center, of course supervised by an expert. 2 physical procedures a day, such as laser and other electrotherapies, magnetotherapy, TECAR or horizontal therapy. Since low back pain is the most common complaint, musculoskeletal complaint affecting every population worldwide, and often complained during and after COVID-19 infection, The program includes balneal therapies with mineral waters, bathing and drinking mineral waters, and etheric oils inhalation. And 3 times a week visits by doctor plus 24/7 doctor on duty services. We have also, I mentioned before, a basic post-COVID program. Also, we have post-COVID hyperbaric program. It includes the basic post-COVID program plus 10 hyperbaric oxygen therapies. Before starting this program, it is necessary to do lung X-ray because the fibrosis of the lung is the contraindication for doing therapies in hyperbaric oxygen therapies. And although many patients are on the basic post-COVID program, due to the price, the hyperbaric program has shown both better results and benefits for the patients. Duration of the program is 10 to 14 days at least. 71 patients was involved, age adults between 40 to 60 years, 78% of them, and 60 plus years old, 22%. In a systematic review, inspiratory-expiratory muscle training, swimming in the aqua center, and aqua training in mineral water pool improved inspiratory muscle strength, endurance time, 6-minute walk distance, reduced heart rate, and also reduced dyspnea, better oxygen saturation in 88.73% of patients, and in 5.63% of them was not improved the 6-minute walk distance, and the heart rate was higher in 8.45 after testing. After the program, patients make the following improvements: improved lung ventilation, strength immunity, improved peripheral circulation, secondary diseases are more regulated, like diabetes, rheumatic disease, and obesity, and patients are able to return to normal physical and sports activity. The network of health institutions in Serbia is divided in 3 levels: primary, secondary, tertiary. Health Insurance Fund of Serbia establishes the network plan for rehabilitation every year, which covers medical indications and the number of beds. After the treatment at the hospital, each insurer visits the medical committee in their district with a request for treatment in one of the spas in Serbia, early or extended rehabilitation, which is indicated for his/her disease or injury. Health facilities in Serbia's spas are in the property of the state by the Ministry of Health, and out of 7,500 beds in health facility spas, 3,500 of them are intended for rehabilitation at the expense of the Health Insurance Fund, since the indications for post-COVID rehabilitation are not in plan yet. These beds are for already established conditions by the Health Insurance Fund. Post-COVID rehabilitation is self-financed by the patients in Serbia, and the price for basic post-COVID program is 50 euros per day, and post-COVID hyperbaric rehabilitation price is 86 euros per day. And I will finish my presentation with a famous saying by a well-known politician, Nelson Mandela: "It always seems impossible until it's done." So I hope that the post-COVID rehabilitation indication will be soon in Serbia too. Thank you very much.
Thank you very much, and congratulations that you could make it happen, at least on the first stage for people they paid by their own.